From this moldy culture plate came one of the greatest medical discoveries of the 20th century. The drug, penicillin, was to save millions of lives. It was the beginning of a revolution in the treatment of infectious disease. Its development, part of the Allied war effort, is thought by many to be as important in the outcome of the Second World War as the atomic bomb. But who should take the credit for penicillin?
It was Fleming's name and Fleming's picture, and Fleming's name in headlines that appeared in the newspapers. We thought at first this must somehow be a misprint for Florey, but it certainly was not.
A long-time controversy haunts this tale of a medical miracle. Tonight, Nova travels back in time to unravel the mystery behind the rise of a wonder drug.
Major funding for Nova is provided by this station and other public television stations nationwide. Additional funding was provided by the Johnson & Johnson family of companies, supplying healthcare products worldwide. And by Allied Signal, a technology leader in aerospace, electronics, automotive products, and engineered materials.
Disease, whose guerrilla warfare against the Red Cross flag has hitherto outgeneraled even the greatest commanders, suffers a setback thanks to the new miracle drug, penicillin. The drug has had lightning success in some of the most...
The triumph of penicillin made international news during World War II. Overnight, legends emerged to explain its strange and marvelous discovery.
This immense stride forward is due to a despised mold, like the common growth on cheese.
Here at St. Mary's Hospital Medical School in Paddington, through this very window 25 years ago, a speck of mold blew in and settled onto Professor Fleming's culture plate.
A mold blowing in through the window makes an enchanting story. But what really happened is even more dramatic. Romantic myths abound, but perhaps the greatest surrounds the discoverer himself. But if it had been left to Alexander Fleming alone, there would have been no drug today. Many who did the crucial work have been forgotten. It was Fleming who enjoyed the adulation of a grateful world. And it was Fleming's story that most of us were taught in school. The history of penicillin is fraught with conflict and controversy. Professor Gwyn McFarlane, a scientist and historian, set out to uncover the full story behind this miracle drug. In his book, published in 1984, he reassessed Fleming's contribution. McFarlane started with Fleming's initial discovery. Fleming kept his original culture plate, and it's now stored at the British Library. Unfortunately, it is badly decomposed, but a replica shows what caught Fleming's attention in 1928. In between a big growth of green mold and yellow colonies of bacteria lay a no man's land of dead microbes. Something coming from the mold had killed them. That something turned out to be penicillin. According to McFarlane, this was a classic scientific observation. But he also points out that Fleming failed to recognize the life-saving potential of the mold. A sense of mystery shrouds Fleming's historic discovery. McFarlane contemplates Fleming's scientific reputation.
Fleming has been widely accepted as a great man and a great scientist by many writers, popular and a few medical. On a par, as if Fleming was really on a par with Louis Pasteur or Galileo. Now, I really can't accept this.
Fleming first became a bacteriologist in the same way he would discover penicillin, by accident.
Fleming had been rather brilliant student. And when he qualified, he wanted to become a surgeon. But in the meantime, he was anxious to get a temporary job at St. Mary's, which would keep him in the rifle team because he was a very good shot.
Arrangements were made, and he joined the inoculation department in 1906, where he would remain for 49 years. He became absorbed in the study of bacteria. It was well known that these germs caused disease, but most supposed treatments were little better than quackery. Infections were commonplace and often lethal. They were as feared as cancer and heart disease are today.
I'm old enough to remember hospital wards absolutely full of patients with septic infections. Many of them young adults or children, and many of them who were in hospital for weeks at a time. Almost every organ in the body could become a seat of an infection. And really, there was almost nothing that the doctors could do about it. For example, I remember very well patients with pneumonia, which was a very common disease in those days, a very dangerous disease, often went on to a complication in which pus formed in the chest. And then part of a rib would be removed and a tube would be put in, and the patient would sit in bed, perhaps for 5 or 6 weeks, with pus draining out of this wound, down a tube into a large jar under the bed, which might easily contain a pint or two of pus. And this went on for weeks.
Ironically, while thousands died from pneumonia and TB, an effective treatment was found for the scourge of high society, syphilis. After 605 attempts, the German chemist Ehrlich had made an arsenic preparation nicknamed 606, which could cure syphilis. He sent some to Almroth Wright, the godfather of British microbiology and Fleming's awesome boss. But Wright believed in using vaccines for treatment and shunned other drugs, so he passed Ehrlich's substance on to Fleming.
Fleming was extremely neat and dexterous with his hands and could be guaranteed to give intravenous injections without the material spilling out into the tissues, which could be dangerous. And as he devised an improvement in the method of diagnosing syphilis, he soon had quite a wide practice.
Fleming's success earned him considerable recognition and the nickname Private 606. It could have alerted him to the idea of treating infection by injecting chemicals into the bloodstream. But under the influence of Almroth Wright, his skepticism of such treatments grew, especially after their experience in the First World War in France, where they began a study of war wounds.
Most battle casualties were infected when they arrived in the hospital. The most common infection was with streptococci and staphylococci, but a less common but very dreaded one was infection by the organism gas gangrene. This produced a spreading gangrene of muscle which moved with terrifying rapidity, and unless a surgeon could amputate above this infection, the result was invariably fatal. Most army surgeons relied on local chemical antiseptics to control the septic infections, but Wright and Fleming soon found that these antiseptics actually did more harm than good.
The harsh antiseptics destroyed white blood cells and interfered with the natural healing process. They were nearly useless against infection. So Fleming's doubts about chemical treatments were confirmed. He might have gone on to look for new agents which could fight infection without causing damage. But Fleming took up other interests when he returned to London, as Ronald Hare, then a researcher at St. Mary's, remembers.
When it came to high-class theory and all the other things that make textbooks, he couldn't be bothered with it at all. He was a damn good technician. If he saw there was something walking in on one stick or something, he'd invent something to do with that stick.
People collect stamps or plants or observations of birds. Fleming did this with bacteria. An example of this, he collected an extraordinary sort of bank of strange bacteria which produced different colored pigments. And he used to construct pictures coloured pictures painted on a culture medium with brushes loaded with these bacteria. And as they developed and grew, they formed the most beautiful little pictures.
But Fleming's more serious investigations did sometimes pay off. Experiments on the fluids of his nose and eyes led to his first important discovery. Using a squirt of lemon juice, he collected his own tears. He found that they contained some ingredient which killed off bacteria in minutes. To continue his experiments, he needed more tears, and so recruited young lab technicians who lined up to undergo the ordeal by lemon. Once again, Fleming made news. The humor magazine Punch called his discovery tear antiseptic. Elmroth Wright christened the new discovery lysozyme. However, lysozyme did not kill disease-causing bacteria. It had no therapeutic value, but it did prepare Fleming for his second major discovery, penicillin.
One day, in the year 1928, he was examining some sepsis germs grown on jelly before sending them to be destroyed. He noticed that one of the dishes had gone moldy, and that round the patch of green mold, the sepsis germs were dying. Some powerful natural antiseptic was obviously exuded from the mold.
Good evening, Sir Alexander. It isn't often that we have the privilege of meeting somebody who's made such an important discovery as you made.
2 months before he died, he was interviewed by the BBC. Fleming tried to explain his historic discovery to the television public.
Well, I got contaminations, and when I looked at them a week afterwards, all sorts of contaminations, but one of them was a mold.
Now, by contamination with a mold, do you mean the sort of thing that happens to a housewife if she leaves the top off her jam too long, that sort of thing? That's
exactly the same. Exactly the same. Here's a good example provided by the BBC. Here is a pot of jam, and on the surface here, on top of the paper, there are a number of molds. Maybe the same mold that I got, maybe not, I don't know.
Molds are tiny organisms that reproduce by casting off spores into the air. One microscopic spore on a culture plate or jam jar can grow with incredible rapidity into a large colony. Molds themselves are common, but very few produce penicillin. Fleming's turned out to be a particularly rare strain of mold. The discovery was not as simple as it first appeared. Fleming always believed that the mold had blown in through the window, but his window was almost impossible to open because of all the supplies he stored on the sill. It's far more likely that tiny mold spores drifted up the staircase from the floor below, where exotic strains were being collected for research on allergies. Even so, it has proved extremely difficult to reproduce the effect Fleming observed, because molds and bacteria each need different temperatures to grow. Fleming's experiments usually involved growing bacteria on plates and putting them in an incubator, where they formed colonies. But on this occasion, some plates were left out in the cold on the bench, and one became contaminated with the mold. Fleming left to go on vacation, and the English summer weather did the rest. First, an unusual cold spell allowed the mold to flourish. Then the temperature went up, and the bacteria started growing. Beneath the lid of an abandoned laboratory plate, the mold started killing off the young bacteria. Fleming returned 3 weeks later. He started sorting through his old plates. Finding nothing of interest, he dumped them into a tray of disinfectant ready to be washed up. Luckily, the important plate was left high and dry above the liquid, only inches away from destruction. Fleming happened to look through the plates one last time to show an old friend what he'd been up to. There, among the dirty dishes, Fleming noticed the extraordinary plate.
The things which had to happen in order to make Fleming's discovery possible form an almost incredibly improbable series of chance events. I think this really illustrates the part that luck plays in many scientific discoveries, but this discovery of penicillin by Fleming must be a supreme example of this.
It was a daily event for Fleming to leave his laboratory down the stairs and come upstairs about 11 o'clock to get a cup of coffee. On this occasion, he had a culture plate in his hand and proceeded to show it to all of us. And I think it would be correct to say that nobody took the slightest notice of Fleming's discovery for a very long while.
Despite the indifference of his colleagues, Fleming embarked on a series of penicillin experiments. But the substance was unstable and difficult to work with, and he soon moved on to other projects.
Now, the reason why Fleming lost interest in penicillin so early, in a matter of a few months, in fact, lie in this notebook, which are his original records of experiments. Briefly, this book shows that he did most of his penicillin experiments in glass containers. And from these experiments, he concluded that penicillin would very rapidly be destroyed in living tissues. Now, living tissues and glass are two quite different systems. And in fact, Fleming was wrong in this conclusion.
What Fleming didn't realize was that his experiments in glass did not accurately reflect what happens inside a living human being. His research had convinced him that when penicillin was mixed with blood, it lost most of its germ-killing power. So he never went on to try penicillin on an animal injected with a fatal dose of bacteria. Fleming thought of penicillin as a local antiseptic rather than a general antibiotic. He concentrated on its unique use as a laboratory tool for identifying and isolating different microbes. Fleming sent samples of his mold to other labs so it could be used in research on influenza. But his published paper did not attract much notice. For 10 years, penicillin was relegated to obscurity. The story of the re-emergence of penicillin at Oxford has its own share of lucky coincidences, but it depended on a different approach to science and the determination of an ambitious researcher who had earned a coveted chair of pathology at the age of 37, Howard Florey. Florey grew up in Australia.
I remember my father consulting the headmaster, and he said, "Oh no, you can't go in for chemistry, there's no outlet in Australia." And it was then that my thoughts turned to medicine.
As a ship's doctor, he worked his passage to England in 1921. He had won a highly prized Rhodes Scholarship to Oxford.
One could get away with any sort of gaucheries as bar, just one of these rough colonials.
Florey was a rough, tough Australian, completely uncompromising, rather prickly, very energetic and tense as a coiled spring. And he brought to his work this extraordinary dedication, which was very infectious in such a way that he really could collect a team of people who became almost as dedicated and enthusiastic as himself.
I had a refugee German chemist named Chain, whom I got from Cambridge.
Chain was a brilliant biochemist, and I think he knew it. He was extremely excitable, and he used to pace up and down a room while he was talking and hiss loudly before making some sort of extremely enthusiastic remark.
There is no blueprint to discovery, you see. I mean, this is an individual, it's an art, really. I mean, you can't lay this down. But the general principle is that you go out and you look for interesting biological odds, interesting new biological phenomena which you hope you will be able to explain in chemical terms.
He proposed, and I agreed to go along with it, that we made a thorough investigation of antibacterial substances.
Chain searched through over 200 scientific papers. Eventually, he chanced upon Fleming's report in a 10-year-old journal. They already had a sample of Fleming's mold in their culture store. Growing it in small flasks was simple. But Chain's job would be to get penicillin, the active ingredient, out of the liquid which the mold produced.
The chemical properties of the substance were most unpromising. It was described as so unstable that you lost it practically while you looked at it.
Not only was it notoriously elusive, but only 1 part in 2 million was penicillin. To separate it from this vast amount of impurity, they tried using solvents. But when they evaporated the solvents, they lost most of the penicillin too. The breakthrough came when Dr. Norman Heatley suggested that changing the solvent's acidity might free up the penicillin. Chain had been against the idea. He was often a difficult man to argue with.
For example, he said in one of the early days penicillin was yellow, and I said, well, it could be, but you have no evidence for this. And his reply was, but Heatley, I am telling you it is yellow, yellow, yellow.
Even after Heatley's process, it still contained masses of impurities. Pure penicillin is, in fact, white.
All gatherings for purposes of entertainment and amusement, whether
In 1939, Britain was on the brink of war.
Large numbers congregating together are prohibited until further notice. Air raid warnings.
Florey made his own film of the lab's preparations for war.
Take shelter.
It was hardly a good time to be attempting research. Lack of funds, equipment shortages, and the risk of air raids were a constant threat. Yet Florey was committed to the penicillin work and focused more and more of his team's efforts to penicillin.
Leave your shelter until you hear the raiders' past signal.
By 1940, Britain was under attack, and the Oxford team was about to make a breakthrough.
On May the 25th, 1940, that was a day I'll never forget. We did an absolutely crucial experiment to see whether penicillin would prevent the certain death of mice which had been experimentally infected with a deadly streptococcus, a kind of disease germ. 8 mice were taken, and all were given a certainly fatal dose of this organism. Then 4 of them were given penicillin.
Heatley kept a diary of the events.
After supper with some friends, I returned to the lab and met the professor to give a final dose of penicillin to 2 of the mice. The controls, the ones who hadn't had penicillin, were looking very sick, but the treated mice seemed very well.
The fate of the mice would determine the future of penicillin. Heatley began his Saturday night vigil.
I stayed at the lab till 3:45, by which time all 4 control animals were dead. It really looks as if penicillin may be of practical importance. I left the labs at 3:45 a.m. on Sunday, this was, when it was already beginning to grow light.
And after, though the shape of the world may alter, in our tunes the laughter blends the tears.
Went to the lab at 11:45 and found all 4 treated mice alive and well.
Florey was ecstatic. He immediately phoned Dr. Margaret Jennings, who would later become his second wife.
When the professor rang me up on that Sunday morning, he expressed his feelings about the result of this experiment by saying, it looks like a miracle. And as he was usually a person who was given to understatement, this was very surprising. The expression he used meant that he was really excited about it.
The next step was to test penicillin in man. But a person is 3,000 times the size of a mouse. The challenge would be to grow and purify enough penicillin to start human trials.
This meant really scaling up an already very difficult process to a point at which a university department really had to be turned into a factory. This had to be Florey's decision, and it was really a very bold one, because this, after all, was a university department, and there was an obligation to teach students and all the rest of it. And to change its character really so dramatically and extensively might have led Florey into quite considerable trouble if the venture had not come off.
Molds grow best in shallow containers that have a large surface area. The team's first problem was to find something to grow the mold in.
What was needed was a layer of medium not more than ½ inch thick in a vessel which could be steam sterilized. We used all the laboratory flasks and bottles and containers that could be used, but they weren't, of course, enough. And we found that you could grow the stuff in tins, curiously enough, and these are some of the equipment we used. But the best container was the hospital bedpan. The Radcliffe Infirmary let us have 16, which was all they had.
Heatley then found a pottery firm that could produce an abstract form of the bedpan to his specifications. On Christmas Day of 1940, he seeded them with penicillin mold. They were finally able to grow gallons of moldy liquid. Once it was purified, they'd be able to begin clinical trials. By January of 1941, they were ready. Dr. Charles Fletcher joined the team. It would be his task to find a suitable patient. Their first goal was to learn whether or not penicillin was toxic to humans. Fletcher soon found a terminally ill woman who agreed to be their test subject. The substance was injected into her bloodstream with no ill effects. Penicillin was indeed safe for human use. But the trial had been fraught with danger, as Dr. Edward Abraham knew very well.
It has to be remembered that the penicillin used in the clinical trials was no more than, in most cases, about 4% pure. And it really was very fortunate indeed that among this massive impurity, that there was no substance that was highly toxic.
Finally, they were ready to test the drug against infection. Fletcher remembers the case of a young policeman.
This policeman was particularly badly ill. He'd had a sore in his mouth about a month previously. The infection had spread over his scalp. He had abscesses there. It had spread to both his eyes, one of which had to be removed. He had abscesses being opened on his arm. He had abscesses in his lung. He was well on his way towards death from this terrible infection. And we had nothing to lose and everything to gain, so we thought we'd have a try. The shortage of penicillin was such that after the first day, I collected all his urine. His urine had been saved, and I took it in a bottle over to the Dunn laboratory where Florey was working, so that the penicillin could be extracted from the urine and used again on the third day. And when I got over there, it was absolutely delightful, because Florey was a very taciturn man, a very man of few words, and he would say, well, how's the patient? He was an Australian with a bit of an Australian accent. And then Chain, who was an Eastern European, was excitable and said, what's the patient like? Is he doing well? Oh, that's marvelous, isn't it? And this lovely contrast in these two characters in charge of the work. And every day I did that. On the third day, he was having the same penicillin as had on the first day. And on the fourth day, he really was dramatically improved. And he was sitting up in bed and his temperature had come down. On the fifth day, the penicillin began to run out and we couldn't go on. Because, of course, when they extracted from the urine, they didn't get it all back and there just wasn't enough to go on. And he wasn't cured. He gradually relapsed and then went on and eventually died.
With so little penicillin available, they decided the next few cases should be children who needed much smaller doses. One was a 4-year-old boy with an incurable infection behind the eye called cavernous sinus thrombosis.
It was a condition that I'd always dreaded as a medical student, and I'd never actually seen a case before, but this pathetic little boy with his eyes bulging out from the infection behind them and absolutely no hope of living. And we started the penicillin infusion. And after 2 days, again, he was much better. After 4 days, he was vastly improved. And after a week, he was sitting up in bed and playing with his toys. I mean, it was unheard of. No such infection had ever been cured before. But alas, the story had a sad end. But because the carotid artery at the back of his brain, it runs through this venous part of the brain, had become damaged by the infection, and one afternoon it suddenly broke and he had a hemorrhage in the brain and died suddenly.
It took almost a year and further clinical trials to support the Oxford team's conviction that penicillin worked. They successfully treated 4 other patients, including a baby.
vessels of all sizes and descriptions, 1/3 of a million men, including the wounded, were embarked and brought home under the protection of the Royal Navy.
Florey realized that using penicillin to save the lives of wounded soldiers could influence the outcome of the war. Fearing invasion, he and his staff took measures to protect the precious substance.
There was a risk, of course, that the Germans might, as Professor Florey said, come rolling down Headington Hill in the Panzers. And so some of us took a bit of the fungus and smeared it in the linings of our coats in order to get a few million spores there. And then if anyone had escaped, if the Germans had come and someone had escaped, one could have started up the culture again.
The clinical trials had exhausted their supplies. The Oxford team needed outside help to grow and purify more penicillin. But the bombing of London severely limited transportation of materials to the British drug companies. There were no such problems in America, so Florey and Heatley headed for New York via Portugal. They were amazed by the freedoms of wartime Lisbon.
There was no blackout. One saw people having, 5 or 6 spoonfuls of sugar in their coffee and music and so on.
They had left behind a disgruntled Chain.
Chain was, in fact, furious when he found that this was happening, but there was a very good reason for Heatley going, because he was the person who had the clearest experience of the production of penicillin in the laboratory.
On July 1st, 1941, they boarded the Clipper for New York.
The Clipper was amazing. About 5 compartments, each as big as my room at Oxford, with luxurious seats, lovely carpets and upholstery.
Their precious samples of mold, having crossed the Atlantic in the Clipper fridge, would now have to brave 90 degrees in New York. In the summer of 1985, Dr. Heatley returned to retrace a journey that would forge the course of penicillin development. With lightweight suits in hand, Heatley and Florey were ready to take on America. Their mission, to spread the gospel of penicillin, and Florey was up to the challenge.
I think he was a very good salesman. All he wanted to do was to persuade somebody to make him about 1 kilogram of the kind of stuff we were using in Oxford and making in Oxford. He wasn't concerned at all whether this or that firm were going to make it on a big scale. That was entirely out of his range.
But before they began their work, Florey had an important visit to make in Connecticut. His 2 children, Charles and Paquita, had been evacuated to the United States at the start of the war. They were staying in New Haven with his old friend and fellow Rhodes Scholar, Professor John Fulton.
Fulton had told certain people a bit about penicillin and had invited them to meet Florey. And they were, I think, prepared to believe Florey. They were astonished.
It was an optimistic beginning. Fulton's friends realized the importance of Florey's ambition and furnished him with valuable contacts.
We were shunted, first of all, to Dr. Tom, who was the sort of eminent father of microbiology.
Intrigued by the therapeutic potential of the penicillin mold, Tom whisked them off to the gigantic headquarters of the U.S. Department of Agriculture. Immediately, cables were exchanged with a remote lab in the Midwest. Within days, they were traveling through the heart of the Corn Belt. The end of the line was Peoria, Illinois.
Well, this was a little different from when you came on the rocket.
When they arrived in 1941, they were met by Dr. Robert Coghill, who took them back to his lab. It had been originally set up after the Depression to find ways of using agricultural waste products. They were already growing molds and bacteria by using techniques similar to brewing beer. Producing penicillin was just such a fermentation process. It posed an exciting challenge for Coghill.
We started work on it the next day. That's how important we felt it was. We pulled Dr. Moyer off the work he was doing at the moment and put him on the penicillin project.
Moyer's great skill was feeding molds. His first step was to check what Heatley used to grow penicillin.
At Oxford, we had had brewer's yeast extract, boiled extract. And when Moyer learned of this, because I was telling him everything that we knew, of course, he said, I'm not too enthused about yeast extract. We haven't got any. But we'll try some corn steep liquor.
Corn steep is a byproduct of turning corn into starch. After the kernels have been stripped from the cob, they're soaked in huge vats until the outer husks are softened. The liquor produced is rich in nutrients, and so forms an ideal medium for growing molds. When it matures, it becomes dark and syrupy.
We have lots of this corn steep liquor around the laboratory, and so it was natural that Dr. Moyer would use it in his early experiments.
At first, nothing did grow, and I remember Moyer saying, I kind of figure we're going to be doing some plain and fancy cussing around here.
After a couple of weeks of Moyer's cussing, their persistence paid off.
Well, a lot of good work came out of this lab, and this was Dr. Moyer's office.
Yes.
Remember how he used to hide his notes when we walked in unexpectedly like this?
Yes, I do.
Cover them up so we couldn't see what he was doing.
It took all of Heatley's tact and diplomacy to get along with Moyer.
Moyer was known to be strongly anti-British, and he certainly was. There was the business of him not telling me what he was doing. I'd been away on a trip, and when I came back, I said, how are you getting on? What yields are you getting? And he said, oh, we're sometimes up to 20 units per mill. And I said, well, how do you do that? That's splendid. And he said, oh, well, I added some chemicals. And from that time on, I never knew what he was doing.
The corn steep liquor was surprisingly productive, but later Moyer published a paper in his name alone. It meant he could take out patents on the corn steep medium without consulting Heatley or sharing in the profits. Moyer's actions did not go over very well in England or with Coghill, his boss.
That was perfectly legal and proper for him to do, but it was not very popular in England to be paying patent royalties on a British discovery. Later, Dr. Moyer and I had a patent together on the addition of an important building block to the medium to get more penicillin, which was extremely successful. And he couldn't do anything without my signature. But I refused to license that particular patent for use in England or any place else. The result was that Dr. Moyer never spoke to me again after that, and his wife wouldn't even speak to my wife.
Moyer's corn steep medium was an important step forward, but it was still not enough. While Heatley persisted in Peoria, Florey went back on the road. His quest for a kilo of penicillin would take him to any scientist who might have a string to pull and could get the drug companies interested. Florey said he sometimes felt like a carpetbagger, but one man would make it all worthwhile. Richards became a convert and got things moving. As the powerful head of a government committee on medical research, he contacted 4 leading drug companies, informing them that government funds would be available for penicillin research. But their response was only lukewarm. The drug companies doubted that penicillin could ever be produced in mass quantities or that there would be any profit in it.
Pearl Harbor is now being attacked. This is an emergency communique from the Hawaiian Defense Headquarters.
Pearl Harbor changed everything. Now the United States, too, was at war. Casualties would number in the thousands. From this point on, penicillin production would become a matter of the greatest national importance. Determined to see penicillin succeed, Richards organized a meeting that he knew would galvanize the drug companies. Coghill would be his trump card.
Dr. Richards called on me, and I reported Moyer's work in raising the yield of penicillin by 30-fold. That was a great surprise to the industrial people, and George Merck immediately got to his feet and said, if those results can be repeated, we'll get the kilo of penicillin for Florey.
The other companies soon followed Merck's lead. The new goal was not only 1 kilo for Britain, but thousands of kilos for the American troops.
Penicillin has been compared to the Manhattan Project, and I don't believe that anyone's really decided which was the bigger project. But in a sense, I would make a guess that maybe more people were involved in the whole penicillin project than were involved in the development of the atomic bomb.
An historic partnership had been forged, yet the drug companies had to struggle against their competitive instincts.
Dr. Richards wanted all the drug companies to get together and exchange information. But because of the antitrust laws in this country, that was a very difficult job to do. There were a few arrangements made, but I think there was very little interchange of information. Every company was protecting itself.
And I don't think that was particularly characteristic of any one company. They were in business, they had to survive, and that was the way it was. But there was a feeling of excitement throughout everything that was going on, and that did pervade everything we were doing. There's no question about it.
Norman Heatley was now assigned to Merck and was sworn to secrecy about their progress. Meanwhile, Florey had returned to Oxford, expecting the quick delivery of his kilo. But he was in for some disappointment.
Florey did get a parcel from Merck's, quite a big one, and he unwrapped it, and inside was another box, and that was unwrapped with mounting excitement. And inside that was a third box, and inside that was this tiny sample of penicillin. I wasn't there, but I think I can imagine some of Florey's remarks.
The American government was strictly controlling the release of the limited supply of penicillin. Still, there were many requests from hospitals. As Norman Heatley remembers, one of the first came from Florey's friend in New Haven.
In March 1942, I got a telegram one day from Dr. Fulton saying that the wife of a rather important person in Yale was extremely sick with streptococcal infection. And could I ask if there was any penicillin available to treat her?
The important person was Ann Miller, wife of the Yale athletics chairman. Through Fulton's influence, Merck got permission to send the drug to her doctors. She became the first American to be successfully treated with penicillin.
I had the whatever scarlet fever serum was available, rattlesnake serum, and of course the sulfa drugs, none of which touched my infection.
With her temperature peaking at 106 degrees, the question facing her doctors was what dose to give her.
And I said, well, don't ask me because I'm not clinically qualified. And then he remodeled the question and said, well, what do you think Professor Florey would say? And that's, of course, a different letter, you see. And so I told him I'm quite sure he would say, don't decrease the dose, and so on. And this went on for a week or two. till Mrs. Miller had quite recovered.
Mrs. Miller's successful recovery became widely known. Physicians were clamoring for the new drug, but supplies were still low and restricted to military trials. The ban on civilian use was lifted for the disastrous Coconut Grove fire in Boston later in 1942. Nearly 500 people died. Hundreds were badly burned. Penicillin was rushed up from Merck to treat the infected burns. By now, there could be no doubt that penicillin worked. And its discoverer, Alexander Fleming, was attaining the status of international hero, much to the chagrin of those close to the Oxford scientists like Macfarlane.
In the summer of 1942, when we opened our newspapers, to our astonishment, we found that the credit for these clinical successes and for the development of penicillin in Oxford was being given to Fleming. It was Fleming's name and Fleming's picture and Fleming's name in headlines that appeared in the newspapers. We thought at first this must somehow be a misprint for Florey, but it certainly was not.
A letter to the Times from Fleming's boss had started it. Fleming had asked Florey for some penicillin to treat a dying friend. The dramatic cure made excellent news. Fleming gave dozens of interviews. But Florey, as a matter of professional principle, refused to talk to the press, and the public remained unaware of his contribution. Instead, Fleming was being given all the credit.
The newspaper campaign was, in fact, kept going by really quite powerful forces. There was St. Mary's Hospital, of course, who relied on voluntary contributions. The second thing was that Wright, who was an influential man, wanted credit for his department, and Beaverbrook, who was a very powerful patron of the medical school and St. Mary's Hospital, and very generous donor, stated quite categorically he felt it his duty to see that the credit did go to Fleming. And finally, the Ministry of Information undoubtedly wanted publicity for good news.
While Fleming made headlines, several British companies were attempting to mass-produce penicillin.
That it may need the product of 100 flasks to cure a single wounded man. Present output only meets the priority calls from the fighting fronts.
In May '43, Florey traveled to North Africa with just enough penicillin to give the drug its most demanding test, the treatment of war wounds. His radical suggestions would transform the management of battle casualties. He took his camera to record the work. This case is the smallest wound he filmed. Rather than leave a wound open, the normal practice, he suggested it should be cleaned and sewn up. Penicillin was then immediately injected through tubes every few hours to prevent infection. The results were miraculous. This man would almost certainly have lost his leg had it not been for penicillin. The British field commanders had been impressed by Florey's treatment of battle casualties and quickly approved penicillin for military use. But the problem was still the lack of supplies. Meanwhile, in the U.S., highly automated bottle plants were now operating. Even so, it was an inefficient process, falling far short of demand. They had to find a way to grow penicillin in large tanks, not just on the surfaces of shallow vessels.
It was realized early on that submerged production would be the only way in which enough penicillin could be produced to meet the demands of the military and civilian populations.
Pfizer did most of the pioneering work on submerged production, but Merck was hot on their heels.
When Dr. Heatley was here at Merck, all penicillin was produced in surface culture, where the organism grew on the surface of a volume of liquid. It was a very inefficient way of producing penicillin because it took such a long time. Therefore, we at Merck decided to develop a submerged process for producing the organism and the antibiotic, and we used an old style fermenter, where there's an agitator which stirs the organism very thoroughly so it goes from top to bottom. Also, it is necessary to blow air underneath the fermentation so that the organism is continually exposed to it.
This deep culture technique did raise yields, but persuading the mold to grow in the body of the liquid was still difficult. A new strain of mold with different growth requirements might solve the problem.
At one point, the War Production Board said that a new culture producing more penicillin would be worth $1 million.
Peoria would once again make the breakthrough. Professor Raper had been searching for a new strain to replace the original Fleming mold since the summer of '41. He enlisted the help of Army Transport Command. Soil samples were flown in from all over the world. The molds they contained were analyzed. The most promising came from Cape Town, Chungking, and Bombay, but the search for an even better strain continued.
We were plating them out and isolating blue-green molds, checking them to see if they belonged to the group that Penicillium notatum chrysogenum belonged to, and then screening them for penicillin production. We employed a girl to make the rounds of different shops and stores and bring in moldy materials. Well, it was in that way that we came across mold on a cantaloupe.
They had searched the whole world, but the best strain was found on a moldy melon in a local Peoria market.
Having picked this off and having checked it and found it was as good for submerged and for surface as cultures we then had, we began to try to improve it.
From this mold, new, even higher yielding strains were produced. By causing repeated mutations using X-rays, ultraviolet light, and chemicals, mutant molds were created and the best were selected. These new strains gave a 100-fold increase over the original Oxford yields. The intensive wartime effort, which had quickly led to the triumphs of corn-steep mixture, deep culture, and new strains of mold, finally allowed the mass production of penicillin. By the middle of 1944, they had made enough penicillin to treat all 40,000 Allied soldiers wounded during the invasion of Normandy, D-Day.
What has impressed me most, contemplating the story of the development of penicillin, is how one needs complementary characters. Fleming was a brilliant observer, but really without either the character or the drive to work out and work through the results. As regards the Fleming myth, I think I feel a bit despondent about our ability to change it in any way. Today, far more people have heard of Fleming than have ever heard of Florey, and I think this will probably continue.
The 1945 Nobel Prize for Medicine was divided among Fleming, Florey, and Chain. Finally, Florey and Chain had achieved the scientific credit due them. But many more still go unrecognized. And perhaps in looking at how science saves lives, the credit is not as important as the effort. The penicillin story is a striking tale of luck, determination, and persistence. and it is shared by many whose names we will never know. Next time on Nova. The triumphant development of penicillin was the first step towards a golden age of antibiotics. Within a decade, there were dozens of new wonder drugs, effective against a variety of diseases. But only a few years later, infections were mysteriously on the rise. The use of these life-saving miracle drugs had itself created a problem, resistance, which threatened to undo their first bright promise.
The pessimists would say that we may have found all the antibiotics there are to find. That in 40 years hence, we may look back on the antibiotic era as just a passing phase in a long history of medicine.
The problem is growing all over the world. And a recent outbreak at an Australian hospital showed just how vulnerable even the most modern healthcare system can be when superbugs outsmart the chemists. Join us next week as Nova explores when wonder drugs don't work.
For a transcript of this program, send $4 to Nova, Box 322, Boston, Massachusetts, 02134. Please be sure to include the show title. To purchase film or video copies of this program for educational use, call toll-free 1-800-621-2131. In Illinois or Alaska, call Collect, 312-940-1260. Major funding for Nova is provided by this station and other public television stations nationwide. And by Allied Signal, a technology leader in aerospace, electronics, automotive products, and engineered materials. And the Johnson & Johnson family of companies, supplying health care products worldwide.